who manages the intensive care unit teams across a number of Western Health sites. And Kylie has seen close at first hand what a COVID outbreak means in our intensive care units. But firstly, can I update the Victorian community on the status of the current COVID outbreak across our state? There were 73 COVID-19 cases reported locally this morning, all locally acquired from yesterday. 52 are linked to known outbreaks and cases, and 21 are under investigation. At least 24 were in isolation for the entirety of their infectious period, and further work has been undertaken over the course of the day with some of the cases that came in later in the evening. This takes us to an aggregate of some 805 cases currently in Victoria, of which 800 are now locally acquired and 5 acquired overseas. In regards to vaccines, getting vaccinated is our way out of this pandemic. It's the key markers on the National Cabinet Plan that will get us all through this, and it is the key deliverer of hope and aspiration of recovery and coming out the other side of this pandemic. And in that regard, we saw 26,702 vaccines administered through our state-run clinics, a further 20% increase on the previous Sunday, and Saturday was also a 20% increase on the previous Saturday. So we're continuing to see strong numbers come out through our state-run clinics, which now run at 2.383 million vaccines being delivered through that system. And we suspect we might close in as a state through all platforms 5 million vaccines being administered over the coming day, total for the pandemic, that is. As you know, the Premier launched the 1 million vaccines program a little while ago, and we are almost halfway to delivering on our goal of that figure through the state-run centres. We are currently sitting at 455,000 doses administered through that program since that campaign commenced. And we've seen a very strong demand on the Pfizer bookings that have been in place across our state sites, and whilst there currently are no Pfizer bookings available right now for first doses in that system, don't give up, because as more becomes available from the Commonwealth, we put more systems in place, and it just goes to show again how strong the demand for Victorians if we get the supply to get people vaccinated. And in that regard, today is actually the day in which both GPs and pharmacies will begin to open up for Victorians aged 16 and above for Pfizer under the rollout. So please, if you can't land one today through the state-run clinics, come back and have a look again tomorrow in coming days, but perhaps even more importantly, go on inquire through the GP network or the community pharmacy network to get access to that. And of course, the fantastically effective AstraZeneca vaccine continues to be available at state centres and at GPs, and continues to be the ATAGI endorsed vaccine, especially for the over 60s. So please come forward and get the best vaccination that's available for you, and the best one that is available for you is the one that's available today. In regards to testing, we know that testing is the other immediate short-term measure that gets us through this outbreak. And yesterday we saw 41,395 COVID tests processed. That takes us to over 1 million tests being undertaken since this particular outbreak has commenced. In regards to people who are unwell with COVID, and given that this is the Delta variant, which is very nasty, we now have 49 people in hospital. 15 of those 49 are in intensive care, and 11 of those are on a ventilator. Brett will shortly speak about where the outbreak is and the particular stories behind the numbers. But first, we wanted the community to hear from someone at the front line, and that is Kylie Fisher. Kylie knows more about the impact of COVID-19 on people, on our health system, and on our frontline workers than just about anyone else. Kylie knows what COVID can do to people in intensive care, what it can do to our health system, what it does to our staff and nurses and our clinicians and families. And Kylie knows what it means to be a member of a community that battles COVID at the front line. So I might ask Kylie to say a few words.
Thank you. I'd just like to thank you for giving me the opportunity to come and talk to you all today. My name's Kylie and I work at Western Health, one of the hospitals right in the western suburbs in Melbourne. And last year, I really want to talk to you about what happened at Western Health. At Western Health, we had over 400 patients admitted to our hospital with COVID-19. And what we also hear is what we hear every day on the news. We generally hear about patients admitted to the intensive care units. But what I want to talk to you today is about the overwhelming numbers of patients that are admitted to the wards in our hospitals. So I'm privileged to be able to work with a group of nurses called the Critical Care Outreach Team, the ICU liaison nurses at Western Health. And last year, they helped prevent hundreds of admissions to our intensive care units by acting as an extension of the ICUs, and they helped support our ward nurses to support our patients and our communities. Now, they would often come to me overwhelmed, sometimes in tears. They were worried. They would come to work worried. They were worried about their colleagues. They were worried about how they would support their colleagues on the wards, looking after overwhelming numbers of acutely unwell patients, patients that we usually don't see admitted to the wards. They were worried about their families. They would go home after 12-hour shifts, long shifts. They would have showers before they would leave work. They'd drive home, get out of their cars, get changed out of their scrubs in their garages, have a shower again before they would go in and speak or hug their families and their loved ones. Now, I saw tears, I saw exhaustion, I saw nurses consoling nurses, I saw blood across the ridges of their noses and their ears from wearing PPE for 12 hours at a time, long shifts on their feet, kilometres and kilometres of Ks. They'd clock up responding to emergency calls and calls for assistance on the wards. What we don't understand is they'd come to me and they'd say, Kylie, it's like nothing we've ever seen before. These patients are young, they're fit, and then the next minute they're well, and then the next minute we're taking them to ICU. Now, you ask me what I'm worried about as their manager. I'm worried I'm going to have to ask them to stand up and do it again. And they will. Now, these are senior ICU nurses who've seen it all before. They've done it all before. And I have to probably ask them to do it all again. They will, but they shouldn't have to. So I'm asking, you know, we're lucky. We've got science. We've got a vaccine. Please, if you haven't already, get yourself vaccinated. Make that appointment. Keep yourself safe. Keep your family and your loved ones safe. Keep the community safe. Thank you.
Thanks, Kylie. Brett?
Thanks indeed, Kylie. A very harrowing picture of last year in Western Health before vaccines were available. Really unbelievable work from you and your team. And we really pay tribute to everything that you've done. And everything we're trying to do in public health is to protect our hospital system from just that scenario of overwhelming numbers needing community care, needing inpatient ward care, critical care, ICU. That is what all our efforts are focused on. Just in terms of the outbreak at the moment, of the local cases I can provide for the 52 that are linked thus far, 9 are linked to the Shepparton outbreak, 5 to the My Centre childcare setting, 5 to Altaqua, 3 to the City of Hobsons Bay outbreak, 2 to Glenroy West Primary, 2 linked to Sunshine Hospital Emergency Department, their household contacts, 2 linked to Chemist Warehouse in Hoppers Crossing, 1 linked to the broader Royal Melbourne Hospital outbreak, 1 to the East St Kilda community outbreak, 1 to Berkeley Square, 1 to CS Square, and 20 cases linked to existing cases, but those original cases don't have a known acquisition source. There are now more than 16,000 primary close contacts and more than 20,000 secondary close contacts. In terms of the location of our newly acquired cases, they're really focused with 7 in Brimbank, 15 in Hobsons Bay, 8 in Hume, 14 in Wyndham, and of course 9 in Shepparton today. Other suburbs though, or local government areas, Banyule, Boroondara, Darebin, Dandenong, Melbourne, Monash, Moreland, Port Phillip, Whittlesea and Yarra. So a really significant spread of cases still, but a lot of focus obviously in the west and north of metropolitan Melbourne and of course Shepparton. In terms of our active cases, and this is the story of vaccination and really points to a difference with 2020. 170 of our cases are aged 0 to 9, 124 aged 10 to 19, 167 are aged 20 to 29, and 150 are aged 30 to 39. So more than 3/4 under the age of 40. That is not the demographic spread of age in our community, to have fewer than 1/4 of cases over 40 years of age. That is the effect of vaccination. That is telling a really positive story. And as supply ramps up, as our GPs and pharmacies have Pfizer available from today, as our state vaccination hubs are doing more Pfizer vaccines, first and second dose, than ever before, as well as having plenty of AstraZeneca available for those eligible populations. These are really, really positive measures that will change the story of who we're seeing as cases and can provide us options as we go forward. In terms of the Shepparton outbreak, there were 2 mystery cases notified yesterday. They are now linked. All cases in Greater Shepparton are now linked in this outbreak. That's a good news story. A key call out, however, anyone who attended Sky Salon Hairdressing on August 15 through to August 19, we believe, please come forward for testing. We believe there are more people who need to come forward who might have been there over those days. The Traralgon exposure site that's been published, really no exceptionally high risk there. The close contact of the case is tested negative, but there are still potential exposures, so please be aware of that, but doesn't look like a high-risk exposure site at the moment. You know, in summary, we're in a very challenging position right now. We are hoping to see a trend, and maybe it's stabilising over the last few days, with numbers not increasing exponentially. We are in a much, much better position than we might have been with exponential growth from the beginning of this outbreak. The number of days from when we had 50 cumulative cases in July is relatively flat compared to how it took off in New South Wales. That is both a tribute to everything that Victorians are doing in terms of following the rules, and the fantastic work of our contact tracers. It still sees a really significant number linked and manages those known and linked cases really effectively. But it's a huge effort required for the Delta variant, and it only takes us dropping our guard just a little bit for that transmission with the Delta variant to occur to household members and within the community. So really, really high levels of compliance, and they are hard to maintain. I accept doing the right thing all of the time in all circumstances is incredibly challenging, but that's what Delta demands of us if we're going to drive cases down. But contact tracing will do its efforts in identifying all of those close contacts and ensuring that there's support to people in isolation and quarantine. Most of the outbreak is under control, but for those areas that are seeing the mystery cases, in particular Hobsons Bay, Wyndham and Hume local government areas, we do see continued mystery cases amongst those other linked cases. That presents a challenge for all of us in terms of changing the restrictions going forward. We do see some reluctance still in people coming forward for testing. There'll be a myriad of concerns about whether your close family members, therefore need to be in quarantine, what that will mean for their work, what that will mean for their potential risk. But there is no, you can't have your head in the sand around this. If you are symptomatic and you might be infected with COVID, the only path for protecting your family, your loved ones, your close contacts is to get tested so that they can know at the earliest possible time and can protect those other family members, those other households, those other workplaces and places that they might go to if they know their status. If they know that they are primary close contacts and can quarantine, they will not put other people at risk. This is not about blaming anyone. This is about being clear that the only pathway to protect those around you, those you care about most, is to actually know your own status with regard to COVID-19. Visit the coronavirus.vic.gov.au website. There are links both for the exposure sites, but maybe more importantly for the financial support tab on the homepage. There's the disaster payment that you're probably aware of if you can't work due to the restrictions. That's up to $750 a week. There's the $450 payment for getting tested and awaiting your result if you have to miss work. There's the $1,500 isolation payment if you have to quarantine for that full 14-day period. And of course there are the relief packages and the business support that's been available through the Victorian Government as well. If you need support, please call out for it. It is available. If you have symptoms, please get tested to protect those you love the most. If you don't have symptoms, please go to one of those vaccination settings, GP, pharmacy or one of our state hubs that are providing more vaccines than at any other point to give us those options that we are looking desperately for. Thank you.
Minister, Tony Blakely said on the ABC this morning that at current rates of infection it would be 6 weeks under the current restrictions to get back to 0 cases. Is that the plan for Victoria?
Well, at the moment, as Brett indicated, the situation has, we hope, plateaued, and there's every indication that the measures are starting to kick in. In regards to specific timetables and in regards to specific measures, the public health team are working on those. But in terms of timeframes, in terms of strategies, the strategy is the National Cabinet agreed position that when we get to 70%, when we get to 80% vaccination rates, our options multiply. And if we do that from the lowest possible infection levels, then our options grow even better.
When do we expect to get an idea of how long the lockdown will be extended by? You said said yesterday that it will be extended, but do we know when we will be told for how long or any other?
So all of those details are being worked through by our public health team, and as the orders and the material gets finalised, and the minute it's finalised, we'll be out to talk to the Victorian community about what that will look like. But can I stress that the strategy has always been the same. Once National Cabinet, all states and jurisdictions signed off on that strategy, our goal is to keep the level of infections down and the level of vaccinations up. And there's hard work to be done in both of those areas.
So is that an acceptance that we may end up staying in lockdown until we reach that?
Not necessarily, no. In terms of restrictions, public health restrictions, we've had public health restrictions on in different iterations for best part of 18 months now. I think we can work on the basis that if we are successful, there will be different restrictions, and the goal is to be successful.
What about a roadmap, though, Minister? Businesses screaming out for that this morning, saying this uncertainty is not helping them in any way plan for anything without that roadmap we had last year.
Well, last year was very, very different. The roadmap exists. It's called the National Cabinet Decision that all states and territories have signed off on. The sooner we get to 70%, the sooner we get to 80% vaccination levels, our options grow in terms of how we can respond. And when we get to those points with lower infection levels, our options multiply even more considerably. So in terms of businesses' concerns, we share those. Families' concerns, we share those. The entire community's concerns. People want to get to the other side of this, and the way in which we get to the other side of this the quickest is by keeping our infection levels low and our vaccination levels high. And the thing that's holding us back on the vaccination levels is supply. And the sooner the Commonwealth opens its chequebook and starts providing us more vaccinations, is the sooner we can get there.
Can we have, though, a different situation for people who are double vaxxed? I mean, wouldn't that be an enormous incentive, even with the grand final, things like that?
Oh, well, in terms of once you get to 70 and 80%, that is the plan that all states and jurisdictions have signed off on, which has as a component of that is being worked on right now about the positive incentives that people who are double vaccinated will have in place for them. And conversely, the measures that those who aren't vaccinated won't have available to them. But that's predicated on there being 70 and 80% vaccination levels, because if you go before then, the Doherty's modelling shows the kind of scenario that Kylie and her team had to deal with last year would be visited again on our public health systems, and none of us are going back there.
Year 12s are just over a month away from doing their first exams. You've said you want to prioritise them in terms of vaccination, but at the moment there are no measures to make sure they can get vaccinated before anyone else in the 16 to 39-year-old age group. What are you doing to facilitate their ability to do those exams?
All 16 and above people in the state are now eligible, and I'm aware of a very strong turnout of 16 and aboves through the available networks that are out there. I've seen evidence firsthand of the really strong levels of engagement that students and their families and teachers have got into the wider system that's now available. And in terms of the SACS arrangements that are now in place, there's been some positive positions put in place, particularly for those that require a show-up SAC that's in place at the moment, that was announced over the weekend. And in terms of prioritising the necessary arrangements for VCE students, so come October, they can start their exams with the certainty of at least some vaccination levels for first vaxxers being in place. There's work underway between education, health and the wider education community to make sure that those form part of the strategies that will roll out. And when we've got more to say about that, we certainly will share that.
Is there work ongoing to get them back to the classroom at some point between now and when they've got to do their exams?
Of course, that will all depend on the epidemiological conditions at the time and making sure, as we've demonstrated with the performance and other SACs that require attendance today and this week, that we're putting in place those safe measures. As soon as it is safe to do so, as soon as the vaccination provisions allow that for the exams and other arrangements, we want to return not just VCE students, but all students as soon as we are, as soon as it is safe to do so. That continues to be our plan.
We've always known when the VCE exams were. The Prime Minister, Scott Morrison, said weeks ago now when Pfizer would open up to 16 to 39-year-olds. You announced last week VCE students would be prioritised. Is there any reason why there was no forward planning to actually prioritise them from the get-go? And just on that...
Supply has been the reason. The constraint that has held us back considerably from that get-go is the lack of supply. All of these groups, if we recall back in when the 1A, 1B and other arrangements were all rolled out at the start of the year, it was all going to be done by October. Clearly, that isn't going to be the case. The constraints have been and continue to be around supply. You can't distribute what you don't have.
But a few weeks ago, we were guaranteed supply of, let's say, even 10,000, 20,000, 30,000 Pfizer doses. We were
Yes.
told Pfizer would open up to 16 to 39-year-olds.
Which it does today.
Which it does today. Why have we not essentially prioritised from weeks ago when we knew when Pfizer was opening up, when we knew what doses we were getting, to prioritise Year 12 students and BCE students to get their vaccine?
Because Year 12 students are members of their communities, as are their families, and now they've all got access to that in the limited supply constraints that are in place. If there was extra supply provided into Australia, it disproportionately went to New South Wales. And we do not begrudge them that. That is, given the circumstances that they're in, others made a judgment that that was the appropriate thing to do. As soon as supply is got into this state, it gets out into the arms of Victorians in regards to the constraints that allow us within those supply channels to then pick out the particular groups who need to be prioritised. Originally it was frontline healthcare workers, border and quarantine workers. Now it's still private residential aged care and aged care workers. And we are working on the basis of making sure that we support not just our VCE students, but all of our school students to get vaccinated as soon as they possibly can and get them back into their classrooms.
Why didn't
Victoria's advice on Pfizer is for a 6-week break essentially between the 2 doses.
Yes.
That 6-week falls in smack bang in the middle of VCE exams.
Its first doses is always been the goal. When it comes to VCE, I think.
So if there are kids who are getting their first doses today, is there a possibility to allow VCE students to get their second dose in 3 weeks' time as opposed to 6?
So we'll work through the ATAGI advice that we're all constrained by as to what's safe and appropriate. That's always been the case. That will continue to be the case. And we'll work through with education and families the best way to make sure that our VCE students and our wider school students can get the support they need to get back and get through this most important year for themselves.
Is the first dose enough to get the exams going? You mentioned the first dose was the goal. Is that enough to say, right,
well,
50,000?
I'm not a clinician, and our resident clinician will be back in a moment. But in terms of the advice that we've got, and whether it's for VCE or indeed from the National Cabinet decision for all school-age kids above 12, the goal is to get the initial vaccine done this calendar year.
Why didn't you prioritise Year 12 students over the rest of the 16 to 39-year-old cohort, given the impending deadline of exams?
Well, you can say, Rachel, why didn't we prioritise any number of really valid and important groups, particularly VCE students? It's because of supply. As we've just announced, it's extraordinarily difficult to get through a Pfizer vaccine, which is the recommended vaccine for the age group that we're talking about through ATAGI, through our state-run systems today, because they're all booked and you can only get out what you're given. Our GPs and our pharmacies can only allocate what they're given. The real problem has been, from the start and is today, the lack of supply. What we need is more supply for whether it's VCE students, whether it's their teachers, whether it's their family members. What we need is supply. We can all step up through our state-run clinics, through our GPs, through our pharmacies, but you can't distribute what you haven't got.
How many doses are we getting this week, Minister? Do we have any sort of transparency on how many we're getting Pfizer doses?
Well, you'd have to ask the Commonwealth that. Under COVID Shield, there's this thing called dynamic redistribution, which allows the Commonwealth to shift vaccines around. That's raised a few questions along the way, but you'd have to ask the Commonwealth that question.
So with regards to allocation on vaccinations, and are you comfortable with the amount that Victoria has received, given that New South Wales received 500,000 doses?
570,000, more than 500,000, is what New South Wales got allocated, and we do not begrudge them that. Victoria got 170,000 extra, but it's this dynamic redistribution that sees material moved around in response to demand issues by the Commonwealth that I'm sure has a very sound public policy and public health grounds to it. The greatest need gets the greatest support, but that has clearly come at the expense of other states and territories.
So now isn't it our time to put our hand up and ask for more doses, given that we're 3 weeks in to this lockdown and cases aren't declining?
Of course it is. And I can assure you, every meeting that state officials and state ministers have with their Commonwealth counterparts, that request, that demand is placed. And as I think the Premier indicated yesterday in his conversations with the Prime Minister over the weekend, there was a commitment from the Commonwealth to make sure that from here on the allocation would be done on a proportionate basis of population, which was always the original model.
Can we ask Kylie a few questions,
sure
if
can.
that's okay? Kylie, can I just ask you, New South Wales currently has 800 people in hospital and a much higher ICU rate. What would happen if that situation was replicated in Victoria?
Yeah, look, if last year was an example of what I have to go on, and knowing that the Delta strain is a lot more contagious, I fear that our ICUs will become more overwhelmed. Last year we managed a large portion of our acutely unwell patients within the ward setting, but I'm worried that being more contagious, our ICU beds will quickly be utilised and that we will struggle to meet the demand of what's required for our community.
And we have surge capacity in ICU, so the beds are there, but can you tell us about the capacity to staff those beds and what's happening in our hospitals with burnout and how our healthcare workers are feeling?
Look, I can't speak in depth to that across the state, but I do know at Western Health that we have very robust surge plans in place, and we have had them in place in 2020, and they were put to the test in 2020, and I know that we're confident that we will be able to serve our community and make beds available. But we don't know what type of numbers we're looking at, and that's, I guess, why we're urging you all now to please get vaccinated and help our healthcare workers.
And when you hear people say, just open up, how does that make you feel as a healthcare worker?
Terrified. I really worry about as much as myself, I'm also subject to lockdown like every other healthcare worker, and I feel for the people with businesses, and I feel for Year 12 students, and my partner is a VCE teacher. And I have a 9-year-old son myself who's being homeschooled, so I understand how difficult it is for our community. However, I'm just not sure that the community really knows what it's like, and to see my team particularly, these are experienced ICU nurses who have got a wealth of knowledge and many, many years of experience amongst them, and to have them come to me in tears that this is something like we've never seen before, and it was quite overwhelming, and that was last year, and now we're looking at a strain that potentially is more contagious.
And can you tell us the difference between the patients that you're seeing from last year to the patients that are coming in this year, their ages and
Sure.
how that's different?
Sure. Look, last year there were many, the ages of patients admitted to Western Health last year varied from the very young, my age, and to the elderly. This year, what I've found as I brief my divisional director and I brief my organisation every day when I'm looking at the patients coming into our Victorian ICUs, the numbers seem to go up quite quickly, and the numbers that are requiring ventilation are coming up quite quickly. And last year in 2020, At Western Health, we found that the patients that didn't require ventilation on the wards were probably higher in number than what were in the actual ICUs. This year I'm seeing admissions straight to the ICUs.
You painted a really harrowing picture of, what life was like in the healthcare system last year.
Yep.
We're hearing horrible stories come out of Sydney as well. Vaccination is essentially our only way out.
Yep.
How disappointing is it that we have millions of AstraZeneca sort of in storage and people are still vaccine shopping?
Look, I think I've been vaccinated with AstraZeneca. I was lucky enough to have vaccine offered as a frontline worker in March, and I've had both of my vaccines. I guess I don't want to. I understand where people may have fears about vaccination, and I guess maybe because it's a newer vaccine. However, the science behind it, we're very, very lucky in this country to be able to have vaccines offered to us, and I just really would strongly encourage people to go ahead and make that appointment just to keep themselves safe and their families safe and help take the pressure off our healthcare services.
But Kylie, when you see thousands of people protesting and saying that the virus isn't real, that it's a government conspiracy, and you've got nurses crying on your shoulder, experienced nurses, we obviously don't want to attack those people, but
No.
from your perspective, as a person who is saving these people's lives, when you see that on the television, in the papers, what impact does it have on you?
It worries me because obviously when I see these things on the news where lots of people are congregating together without social distancing and without face masks, I worry about the impact and the flow on into the hospitals. And I can, with my hand on my heart, stand here in front of you all today and say it is very, very real. It is happening. It's not a conspiracy. It is a very real thing.
Almost everyone who's been admitted to hospital in the most recent outbreak has been unvaccinated. In light of that, what's your message to people about vaccination?
Please get vaccinated. It's the best way to keep yourself, your community, your loved ones safe and help to, make sure that our healthcare workers aren't overwhelmed and then that they can help support patients when they do need our help.
Sorry, can we just get Brett on the talk? That's okay. Sure. Just ask a couple of questions.
I was going to ask Foley, but yeah, sure.
Thank you.
I'll just add on vaccines.
Sure.
It really is our pathway out, and we've got a lot of bad news around Australia at the moment with respect to COVID, but AstraZeneca, there are signs that the immunity that you get from AstraZeneca might even be more long-lasting than Pfizer, and that it will outperform Pfizer 6 months after getting vaccinated. One of the other advantages in a rollout that's been slow across Australia in global terms is that we're getting our Pfizer doses in the middle of this Delta outbreak, and so the peak of protection from the Pfizer vaccine is going to happen when we've got really significant pressure of cases. That is good for us in terms of our population immunity. We just need to crack on and get to that 70-80% level, and there are good news stories around the world. Iceland, Denmark, Singapore, different countries, different demographics, but they've gotten to 90% of their 12-plus population, 90% plus. So 70% population coverage, and controlling Delta with that level of vaccination coverage and easing restrictions very substantially. That's where we're headed to. That's where we want to head to. And that is going to be available to us with the highest levels of vaccination coverage we can get. Sorry,
Is your advice to government still that we need to get to zero, or is it to keep the numbers low as the National Cabinet strategy?
We have to do what is feasible. We are not going to achieve the impossible if it becomes impossible. But the aggressive suppression strategy is pretty explicit through National Cabinet. It is doing your utmost to keep those numbers down, to manage the health system, to get to zero if you possibly can, but not with some absurd hope if numbers continue to increase despite everything that you're doing.
So in our current situation right now today, is zero possible?
I can't say. I know that we can do better in terms of all of the things that we're building as our public health response pillars: communication, engagement, the compliance with our restrictions, the testing and the vaccination coverage. They are all things that can help drive numbers down. We could do better in each and every area. We know that more people could come forward for AstraZeneca. We know that people could follow the public health restrictions even more strongly. We know that dropping our guard from time to time just gives Delta that opportunity to break through and cause another workplace, another family outbreak. So we can do better. We're stabilising. That is still a positive element in terms of having relatively low numbers in our ICU.
If it becomes apparent that zero is no longer an option, and I say this knowing that it didn't quite work last year, but with the added advantage of vaccination this year, do we look at specific rules for specific LGAs so that other people can enjoy freedoms? Is that on the table this year?
I wouldn't say it's off the table. I think we have to see how the virus is moving around. Clearly, we're doing pretty well in Shepparton. That gives options for regional Victoria in particular at the moment. Metropolitan Melbourne has exposure sites right across the metro area. I don't want to be in a situation where you drive people to leave certain LGAs to go to other LGAs and seed it more broadly. So we have to bear that in mind, how human behaviour responds to restrictions being in place or not being in place. But to the extent that we can apply things differentially, we've always tried to do that.
What about the double vax though? What about people who would right now double vax before other people? Why can't they prove it with their passport or such and give them immediate freedoms now so that the economy can benefit, you know, mental health, all the rest? What's the reason why we can't do that for those people?
Well, this has been talked about and planned through National Cabinet for a long time. It's still being worked up. I don't want a situation where we've got differential rules in Victoria compared to New South Wales or South Australia with respect to doubly vaxxed people. It would be great to have national consistency for the issues of equity and for the issues of perceived fairness. But I think that there are reasons for doubly vaxxed people to have greater freedoms, greater accessibility for certain settings, but that's still being worked through.
Is the playground and the curfew under review this week? There are discussions about changes or extensions to restrictions. Is it all in, or is there some movement?
No, everything's up for review whenever we come to this point of reconsideration. Yeah, we'll look at that. We have to bear in mind that transmission can occur in all kinds of settings, but it's a balancing act. We want to make sure that people can sustain those behaviours. We want to make sure that mental health of adults and kids is supported to the fullest extent that we can within these awful constraints of lockdown that is supporting our health system and the health system response.
There are some mental health, just to follow from that, sorry. Obviously, 18 months into this pandemic, it's a bit of a different landscape. So rather than driving cases down to zero, do we need to weigh up the mental health?
We've always weighed up the mental health issues. Part of the reason why the public health response has been what it's been is to get to a point where we can freely ease restrictions to allow people to live the lives that we know that we want to live as human beings. So all of that has been a primary consideration right through. It remains a consideration in everything that we are making determinations on going forward.
We're seeing more children present with mental health issues in this last period, you know, the stats. So, you know, do we need to weigh that up rather than continuing to focus our eye on driving down?
It is not a question of just focusing driving transmission down. We are absolutely thinking of that. We are thinking of, at the same time, what the consequences of opening up too much would be, both for children's health, the long COVID considerations, what it means if they were to introduce the virus back to their families, what it would mean if transmission between children would be a real driver of, you know, the epidemic increasing really significantly. The 40,000 cases that are occurring every day in the UK at the moment, in part is driven by the fact that there are unvaccinated kids because they're not yet eligible or they haven't got the coverage of the 12-plus age group that they would like. In countries that have gotten to high coverage of the 12 to 15-year age group, they've gotten better control. There are, as I've pointed out before, there are literally millions of children orphaned by COVID. There are families in New South Wales at the moment who are struggling with one or both parents being hospitalised or dying. those are mental health considerations for kids, as for all of us.
There are obviously a couple of restrictions that would be completely off the table, like, home gatherings, for example, or opening theatres or restaurants. What are some of the safe things that could potentially be eased, and what are they?
Look, we're working through those at the moment. There's nothing. There is nothing to announce today. Clearly, we've always said there are higher risk settings. The lower risk settings are those in which the gatherings are much smaller, where it is doubly vaccinated people who you expect, so the age groups that are eligible in that regard, in outdoor areas and where it's not prolonged contact, or where it's in a regulated environment, where there's check-in, where there's an opportunity to be able to contact trace. So all of those things are in our mind in considering restrictions and easing of restrictions.
Yesterday, the Premier had said he had received...
Can't work at the moment, but we've got examples of mobile massagers that can go to people's homes and provide this service. Is there inconsistency there that perhaps if we are seeing a plateau in the numbers, we could open things like dog groomers? There's a lot of
these are things that would be under consideration if they are regarded as low risk. We have to think about whether transmission might occur, with compliant businesses or non-compliant businesses, because there's always a proportion. But you're right, where there are limited person-to-person interactions, they are the lowest risk settings. With respect to massage, it's not massage, it's critical medical support to people who need allied health intervention as an emergency or as something to relieve a really significant medical condition.
We could have dog groomers though last time around, and we can't this time. I mean, what's the difference?
Look, let's consider it as we go forward, but nothing to announce today.
Yesterday, the Premier had said that he had received medical advice just yesterday that we could essentially drive case numbers down to zero. Given it took us about 60 days to get from 100 to zero last year, with obviously a less virulent variant, and with the same restrictions in place, what makes us confident that we will be able to drive down cases the same way we did last year?
Look, I'm not talking about being confident or lacking confidence. I think we need to do our utmost, again, in line with the national strategy of aggressive suppression. We have got a different situation with respect to vaccination coverage for some of our most vulnerable populations, and indeed, our aged care sector, tragically last year, was not just settings where so many tragic deaths occurred. It was also a driver for transmission, as those essential workers worked across facilities, took cases back to their families unknowingly. So it was also a driver of transmission that made last year particularly challenging. We've got a significant proportion of our workforce, of our aged care and health sectors, that can be amplifying environments for transmission, highly vaccinated now. So that does change the dynamics. But I'm not second-guessing where we might be able to get to in 2 weeks, in a month. We will do our utmost, and we will try and balance all of those elements of what is a proportionate but necessary response to protect our health system.
Care, as part of National Cabinet decision-making, I guess, aged care workers need to have at least their first jab by September 17. That hasn't been, written into the public health orders, or there is no legal mechanism currently to mandate it in Victoria. Where are you up to with that?
It is absolutely on track. It is expected to be in place. We have communicated the expectation that the sector needs to ready its workforce to make sure that those who are attending and rostered for those shifts will be vaccinated by that deadline. So that's our expectation. That's what I would expect to see by mid-September.
And this is obviously a federal government responsibility, but do you know what the plan is if we still have a large chunk or even a small chunk of the aged care workforce not vaccinated by September 17? Where's the surge workforce? How do we actually, how do people care for the elderly people in these homes?
Look, we've clearly flagged that at Aged PPC as an issue. It's been brought up at health ministers' meetings, and maybe Minister Foley can speak to that. We have flagged it as a concern. The Commonwealth needs to manage that workforce that they've got responsibility for in private sector aged care. For the public sector aged care workforce, we've got very high vaccination coverage already, so the implications for the workforce, I think, are much less. But the risk is there. There will be some individuals who will choose not to be part of that workforce ongoing, so the planning needs to really happen at the facility level, but also at the organisational level for those networked aged care facilities that have a workforce that might move across.
Will Parilla Lodge aged...
Is that a close contact of someone who visited the shopping centre, or is that something you found historically?
I don't know the details. I imagine it's a close contact, so we're assigning it to the CS square, but it won't be a new... I doubt whether it'll be a new exposure from one of the shops within that square.
And in terms of the western suburbs, where are you sort of seeing the transmission happening at the moment? Is it exposure sites? Is it workplaces? Where are you sort of seeing the areas you need to jump on?
Oh, look, it is those retail settings that remain open, so food. There'll be supermarkets as exposure sites, but some of those essential services like a pharmacy, food distribution centre, they are the places that have to remain open and do remain open, so they remain a risk for transmission. That's why wearing masks remains important. That's why getting tested immediately remains really critical.
And there was a Shepparton aged care facility, Echuca, aged care facility. It's been listed as an exposure site for about 13 days, but I think all the staff and residents have tested negative. Is that correct? Is there any risk there that we should...
Look, the determination of an exposure site tier is really for the local public health team to look at the risk and to take an appropriately precautionary approach. They don't want, by any means, transmission within an aged care facility. Those early tests of staff and residents is really good news that there hasn't been anyone tested positive. They still need to go through that quarantine period. They could still test positive, but it looks under control and clearly there's been no transmission detected yet.
Just on Shepparton, it's doing well, as you said before. You sort of hinted that regional Victoria might get some sort of a reprieve. Are you planning that they might be the first to go and maybe fencing off Shepparton or keeping them, locked in and the rest of the region where there is nothing?
Yeah, no immediate determination, but we would clearly look to whatever options we can in releasing restrictions for places where we don't see transmission. We don't think they're too substantially at risk because of the movement of people or because of exposure sites. And it's just good news that all cases are linked in Shepparton and that the public health response can wrap around those close contacts, of which there are thousands.
How close are you to making an announcement for even regional Victoria first or the rest of the state?
Look, it'll happen over the next couple of days.
Over the weekend, there was talk about Sunshine West and the industrial site and wastewater detections repeatedly coming up. Is there any update there, and is there anything specific happening in terms of testing of workforces there? Yeah,
we've tested at very high levels a number of workforces there focused on that area that the wastewater catchment represents. So 90+% coverage for those workforces. We haven't detected a positive case. It may be that someone has recovered, remains infectious in terms of excretion of virus in wastewater, but not testing positive on the nasopharyngeal swab. So that's a possibility. Nonetheless, they could have transmitted to others. There might still be people who have been exposed and are yet to become unwell. So we need to continue the call out for testing and for anyone symptomatic to come forward as well.
The Royal Melbourne Hospital's Aged Persons Mental Health Inpatient Unit at Broadmeadows Hospital has had 2 cases in the past week, and I understand there's also been a case at the Broadmeadows Hospital. What cluster are they linked to? Are they part of the Broadmeadows cluster or the Royal Melbourne cluster or something else completely different?
Yeah, I don't know for all of them. There are some that are clearly linked to the Royal Melbourne Hospital that were transfers across, but I don't know that applies to all of them.
Right.
Just one last question. Yesterday the Premier said people are presenting late with symptoms, and he said that anyone attending the protest isn't likely to come forward and get tested. Are you concerned that undetected cases are circulating in the community?
Yeah, of course. We always make the assumption that there are cases who are symptomatic, who are positive, who haven't yet come forward for a test. I can't say it enough that testing is the way to protect your family, your close contacts, your loved ones. It is also a mechanism to protect you if you are diagnosed early in an illness, and we've seen from the Delta variant, it's not just more transmissible. For those who are unvaccinated and for those who are vaccinated, if you compare the Delta variant to previous variants, you are more likely to be hospitalised, 2.7 times more likely to be hospitalised. What we're seeing internationally is that through this wave, there are much fewer cases relative to the number of overall cases, there are fewer cases being hospitalised. That's because of the high vaccination coverage. But for one individual who's vaccinated compared to previous variants, you're more likely to get severe illness. For any case who's unvaccinated, you're much more likely to get severe illness. So getting tested early is also a way to have access to appropriate treatment and care. And you may have heard of the Sutton monoclonal antibody that is now available in Victoria. We've got a distribution plan for it. It'll probably be given to patients starting this week, if not tomorrow. And it works on neutralising the effect of the virus for people who are eligible and who are most at risk. So more elderly, people with chronic illnesses, people with immune conditions, people who haven't got the ability to respond to vaccination because of their immune system, as well as others might. So getting tested early means that you can have an early intervention with a monoclonal antibody like this, or some other medical intervention that can make a difference to your outcome, keep you out of hospital, and absolutely keep you out of ICU and keep you from dying. So can't say it enough. Get tested early to protect others, but also to give yourself the best chance of staying out of hospital.
Workers at the level crossing removal site at Edithvale were yesterday told initially that it was a Tier 1 site. I understand a worker tested positive immediately after he'd spent 2 days working there. It was then downgraded to Tier 2. What was the basis for those upgradings and downgradings?
Well, you're following these exposure sites more closely than I am. That's very much in the weeds in terms of the public health response. I don't know the specifics. They always look at those sites. They understand the interactions of individuals. It may well be that a workmate shared a car or shared an office space, and that was the reason for transmission in that case. But I'd be guessing downgrading to Tier 2 is often based on that first flush of tests that come back for everyone, and an understanding of what the interactions between everyone on those work sites might be, and it's obviously been deemed a lower risk. It'll be reviewed all of the time, and if there are further positive cases, it may well be upgraded again.
There are workers who are concerned that that a Tier 1 grading would have had a huge impact on the project. I think the Frankston rail line was due to be closed off as a result of this soon. Are you able to reassure the public that this would have been based on the infection risk and not the risk to the project?
Yeah, it's always based on the infection risk in terms of the public health designation of a tier level for any exposure site.
How does the antibody treatment work? Is it a blood transfusion? Is it a nasal spray?
Yeah, you get an infusion. You are hopefully able to remain at home. So the infusion happens over a 1 hour period in an outpatient setting, I imagine, or a day clinic setting, and you can stay at home, and it protects you from that more severe illness. The antibody works by attaching, as for any immune response, attaching to the virus and neutralising its effect on the body and on the cells. So a really positive development. There are over 7,000 doses that have been acquired, procured for Australia. There are 500 available in Victoria as of now.
When do you think that's going to be widely available? Obviously, you've got to test to see if it works. Is that something that in 6 months' time there might be a treatment if this is successful?
Oh, look, it's already in the treatment category, so it's gone through approvals internationally and in Australia. It's now really in the consolidation phase where it's given to patients, and we continue to monitor the clinical differences that it makes by virtue of being given.
And does that give you more options for removing lockdowns if there is a treatment and there is vaccinations?
Oh, it certainly gives us an assurance that our health system can be protected from those more severe cases that would otherwise require intensive care. So anyone who gets downgraded from dying to surviving, absolutely a worthwhile treatment, but also from intensive care to being managed on the ward or not requiring admission in the first place. They are all positive things with this particular treatment.
Can I ask a follow-up question that's not COVID related, if that's okay? There are serious allegations of domestic violence and assault against the head of an ALP-affiliated union, included in a sworn statement from his wife. He's previously been convicted of family violence allegations. Should John Setka stand down pending an investigation?
Oh, well, I'm not commenting on a matter that is before Victoria Police, and that is an internal matter for an affiliated union to a political party for which I'm not a spokesperson for.
What message does it though send to domestic violence victims that he won't stand down? And also, what message does it send to victims that, you know, an ALP member won't comment?
Well, the matter is, as I understand it, by what you've just said, before the Victoria Police, it would not be appropriate to comment on any specific matter that is before Victoria Police, particularly by a member of the government executive. Having said that, this is a government that more than any other government in the country, let alone the country's history, has made family violence a key part of what it is to be safe in Victoria, and to call it out and act against it. And in regards to specific matters, particularly if they are before the courts, that is a matter for the courts.
Can I ask you a question just on the hospitals being under extreme constraint in the current situation? Junior doctors have also pursued a class action over the dire working conditions in hospitals, so this was an issue prior to the pandemic.
Yes.
Over 60% of junior doctors are making a clinical error due to fatigue. So what's being done to support these doctors, and especially now in a setting when we have such a shortage of resources in our medical setting?
So as I understand, the class action claim against a number of health providers relates to junior salaried medical officers, and all I can say there is, if you're entitled to overtime and if you're entitled to payments, then you should get paid it, no matter who you are, whether you're a salaried doctor or whether you're a hard-working ward or ICU nurse specialist, or you're anyone in the Victorian healthcare system. So I can't speak as to particular issues that the salaried medical officers are pursuing, other than I understand there are proceedings underway in courts. Government's position has always been, if you're entitled to it, you should be paid it. This has been an ongoing issue since at least, I think, 2002, and I would urge all parties to negotiate in good faith and resolve the matter.
Just on in terms of, sorry, just to follow that, I guess you've got that now doubled with the fact that we've got hundreds of medical staff in isolation. How do you think our medical system will cope under the current circumstance?
So look, as Kylie's indicated, our healthcare services are always at full throttle. What we want to make sure is that the risks of COVID and the risks of perfectly predictable and perfectly able to be forecasted demands of COVID don't enter the system. And we can do that by getting vaccinated the first opportunity that you can. And we can do that by making sure that we follow the public health rules. Those are the measures that will take the pressure off our public health system and allow people like Kylie to deliver the world-class service that she and her colleagues do in a way that the Victorian community has come to expect.
Just on business support, in New South Wales, the federal government has a partnership with the New South Wales government to provide a scheme called JobSaver, which I think came into effect from the 4th week of their lockdown. We'll be entering the 4th week of our lockdown as of Thursday or Friday. Are there any plans to introduce that kind of support in Victoria?
I'm sure there's always discussions between treasurers and economic development ministers, and I'm sure that those commitments that both levels of government have made to support businesses in Victoria will continue on.
So you're hopeful that Victorian businesses will receive the same support as New South Wales ones?
Well, I'm not the relevant minister in terms of the particular details, but what I would, whether it's provision of vaccines or the provision of support, we want to make sure that Victoria is treated in exactly the same way as every other state, so we can get to the other side of this as quickly as we possibly can. All good? Thanks, everyone.
Thanks.